Okay, hello Periscopers. We are here with Maria and we are doing our demonstration for the facial filler. This is the Bellafill. So Maria, what I like to do we have a mirror? We'll go get the mirror. I like to start out by hearing where your focus is. That way I know we're addressing what's important to you. So
obviously these little lines, there's one that comes right across here. I don't know where that one came from. And around here.
Okay.
And then I had surgery. If you see, I have a little line under here, over here. And they put something in here which disappeared.
Okay. All right.
After time.
So have a look in the mirror, and I'm going to hold the mirror like this so that the way you're looking for, that's how we address people conversationally. Make a big smile for me. See how it plumps up the cheeks? Now relax as best you can. So in these areas you can fill, I would not do filler there. You could do a laser treatment, but for today, for the demonstration, you can do some fill in through here and fill in the valley. It's like putting a hand in the glove. It re-inflates. So we can't make it perfect. You may be satisfied with one session. You may not be satisfied until you do a second session. And that's the only way we know we're not going to overdo it. You follow me on that?
Definitely.
So I would tell you we could do a little bit through here, maybe a little bit in the crease in that area. Okay? How's that sound?
Sounds good.
All right, so we talked about things before, and I'm going to do a little cleanse on the skin and a little bit of the numbing. Do we have all that all set up? So we're ready to bring them back through here. So for you Periscopers who are out there, I'm Dr. Rich Castellano, the Smile Doctor. We'll be doing a filler treatment, so if you want to see how fillers are done, just hang in there. Thank you for the hearts. We do appreciate you guys. And hearts for Maria for being our brave volunteer today. And she was our lucky raffle winner. And can I show them your picture here, Maria?
Sure.
So I like to ask people to bring in their photos from when they're in their 20s or 30s, and you can see how the volume in our face changes. If you look and see the volume in her face versus today, which she looks great, but now she's got more fullness when she's younger, and she's lost that. We're going to build that volume back up. So thank you for joining in. We're just showing the difference between facial fullness. So this is so Periscopers can see when we're young how full of volume we are, and now we're just replacing that. So what I'm going to do is I'm going to do a little cleanse on the skin, and we're going to bring in, we have our audience today, so let me just let them know. Christine, can you bring them that we're ready and we're starting right now? Okay. Thank you for your patience, Periscopers. We're going to be getting started here. I'm doing a little cleanse on the skin. We're doing a broadcast now, so if you don't want to be a part of the broadcast, just you can just stay either to the side or through there. There you go. Yep.
Right here, right. Because I know we want to be on.
So you bet you didn't think I was going to be back again.
No.
Oh, okay.
I'm very surprised.
Are you excited?
All right. Close your eyes for me and then a little cleanse on the skin. So we do a cleanse on the skin. Minimize, it's very rare to have an infection with fillers, but we like to do the cleanse anyways. Come on in, the broadcast is coming straight through here, so if you don't want to be in the broadcast, just stay on, you can stay on the side over here. Yeah, I'll scoot this over here as well.
That's my neighbor. I brought her.
Where's going to be broadcast? When?
All across the world, it's live.
Almost anywhere. Oh.
Once y'all come on in,
Yeah,
you can come stand over here. And so, Maria has not had fillers before, and we're just going to do a little bit. I told her you don't make it perfect with the fillers, but you make it a little bit better, and I like to do some of the numbing medicine. And so what I like to do is I like to mark the areas first. So I use a little white pencil. I'm going to do a little across here as well. So Maria, take a look in the mirror, and these are the areas that we were talking about. Is that what you're thinking? So before I do the injection, I like to make sure that anything else that we're going to do. If I do full face treatment, make a big smile for me, big smile. See how it plumps the cheeks. And then as we get older, relax as best you can. We lose the volume. I can build this area up, and it addresses down here by lifting the cheek up just a little bit. And you can see in her picture here how the volume in her face, changes over time. That's what happens to all of us. So you see the volume in her face, and how as we get older we lose the facial volume. If you want to look younger, you just got to put that back where it already was. Okay? So now I'm going to do a little bit of the numbing medicine, and when I do the numbing, I like to use, come on in so everyone can see. Very good. So when I do the numbing, look, and I'm going to hold the mirror for you here. And rest your head all the way back. I use this little buzzer as a distraction. So you feel the buzz, and then you feel a little pinch on 3. 1, 2, 3, pinch. You feel a big pinch or a little pinch there?
Little pinch.
So, and let me just do this here. One moment. Got some. I'll make sure that the needle is not on. It's just dripping, so I'll tighten the needle here. There we go. Feel buzz in. Numbing there. Can you bring some gauze over those things? I'll help you out with that. Rest your head all the way back. So you feel buzz and pinch. 1, 2, 3, pinch. Just hold pressure just a second. A little bit of the numbing medicine. Some people want a little more numbing than others. You feel buzz and pinch. 1, 2, 3, pinch.
Now you're just numbing?
Correct. This is some of the numbing medicine, like at the dentist's office. Maria, how you doing, dear?
Okay.
We try and make it easier than getting a tattoo.
I don't have any tattoo.
Thank you. Feel buzz and pinch. 1, 2, 3, pinch.
Is that the first thing they teach you in surgical school is that 1, 2, 3 pinch part? Every doctor says it. You're gonna feel a little pinch.
Yeah, well, it's otherwise if you shock them with it, then they're like, ah. So you got to let them know it's coming so that they don't jump on you. Yeah, that's an important.
The buzzing
part.
is good.
Did the buzzer help a little bit?
Sure.
I was thinking how good it'd feel on your neck.
Yeah.
And then what I'll use the needle for treatments inside of the skin if I'm trying to thicken the skin a little bit. So I do use the needle for that. Now, you feel a little bit of a pinch here. A little pinch, 1, 2, 3. You feel a little pinch or not too much? So you feel a little pinch, and then I feel just some in the crease there. But as you can see, even if she's feeling some of the pinch, it's not something that's unbearable. Do you feel a little pinch here? Big pinch or little pinch there?
Little pinch.
Okay. Then what I do is I make the insertion point because I'm going to use the cannula here. And the goal is to try and fill in that area with a little valley. Okay, if you have any questions, let us know. And you can see it's a no downtime treatment. You typically can pass the grocery store test the same day. I'm going to turn your head this way, which means you're walking in the grocery and no one does a double take. You might feel a little pinch there.
Now what are you filling it with?
This is the Bellafill. And you fill in that little crease.
So that works just like Juvederm does, it pumps the skin up
It
immediately.
plumps it up, yep. And just lasts longer.
How many years does that last? I know Juvederm
permanent.
can go to a year. I mean,
Permanent?
So that's never, you never have to do it again.
It doesn't go away, but the body keeps losing volume. You keep aging.
Right.
So you may come back and do more if you've had some aging changes.
No, I had a doctor once he said the only thing he could do for me was take fat out of my,
How did that work
Fat
for you
loss,
when you did the
right.
fat?
didn't last.
That's the most common thing I hear from fat grafting. 95% of people say, well, I did the fat grafting and it worked, but it didn't last. And they say fat's supposed to be permanent. But I hear that more commonly from many people. So that's why I feel that the Bellafill is a higher satisfaction option. I'm happy to do fat grafting if someone wants them.
The only
That's what I
thing,
wondered if they still did those.
Yeah.
Okay.
But this is simpler and easier. You don't have to harvest from one area, but this I do believe it lasts longer.
my only problem was, that's the only place you could find any fat, but then people called me butt face.
Oh.
No, I'm kidding.
Yeah.
If you have deep
Right.
then it would take quite a bit of the permanent fillers to do the deep folds in your face.
It may take more. It depends on the person. So that's where the one-on-one is helpful. And if you build the cheek, this area also improves. You can build this up. So doing full face treatment, you know, a lot of people come in and say, well, I want to treat these areas here.
Mhm.
But you look better when you do the full picture. It makes you look younger. And you can't do too much here because you don't want to look bottom heavy. Thank you. These are all good questions.
Because I've had I do Juvederm and I do Botox. That's why I'm here to see what the difference is.
You feel a pinch there, Maria?
Mm-hmm.
Big pinch or little pinch?
Little pinch.
So as you can see, it's a simple treatment. Matter of fact, this morning, we've already done 25 syringes of filler for patients. We've just been doing it all morning, and then we did our event. Because you can see there's just no downtime. People walk in, they walk out. A little bit. You're already getting some compliments from the audience.
Yeah.
But you can see how it fills that crease in.
Yeah. Wow. Look nice. You are
Wow.
such a
Where
happy
am I
girl.
gonna go?
Yeah.
Excuse me. Maybe somebody will notice when I go to the doggy park with my dogs.
See if Glenn notices when. See if he says anything.
And the men are so slow to notice sometimes.
I'm going to turn your head this way now.
That's my husband.
You know, some people are really tuned in and some people see more than others.
I could shave my head and my husband probably wouldn't notice.
You're funny. So, we're done. That wasn't too bad, was it?
No,
That's wonderful.
Let's take a look in the mirror.
actually I've been sleepy.
Hold this for me, please.
Oh my goodness. Yep,
You like it?
yeah, it's definitely different.
So you see the benefit of the fillers in that you get an immediate result. There's no downtime. You have long-lasting options. You have temporary options. So what we're going to do is we're going to get started with our one-on-ones. And let's give Maria a hand. Okay. And we'll be starting with the food. And I look forward to talking to each of you soon. Now, Allie's going to set up an appointment. We like to do a 1-month follow-up. We'll take pictures and follow along. And then you got my card and information. If you need anything, let me know. But I like to do a 5-minute massage 5 times a day for 5 days. You're just pushing and massaging in that area. Okay? You can't hurt the product.
Okay, so 5 minutes every day.
5 minutes, 5 times a day for 5 days. Thank you guys for tuning in, and we look forward to talking to you soon.
Yeah.